Hi, this is Yashasvi from Health 2.0 conference. I am here with Huma. First of all, congratulations for getting recognized on our platform, Huma.
Thank you so much.
Can you please introduce yourself?
Yes, it is my absolute pleasure to talk to you today, and absolute pleasure to be on the platform of Health 2.0. It's wonderful to be here. I'm Huma Qamar. I'm the head of clinical development AVP at Ocugen, and I am overseeing currently vaccines, cell therapy, and gene therapy slash ocular programs in the patient-centric biotech located in the heart of Melbourne, few miles away from Philadelphia, USA.
I see. That's really good to know. Can you please let us know what led you to winning out this award?
Well, it's a great question, and what led me to do this is a lot of, I would say, many years of hard work, blood and sweat that has gone into my career. I'll
Right.
tell you a little bit about my background. I am a physician who I think it's I can just put it together in a few sentences because the journey has been long.
Right.
But for the people who are watching at this time, I graduated in 2000 at the end of 2009 from Army Medical College in Pakistan. I got a scholarship from Yale. I started my journey from Yale University Hospital, then worked at Harvard, moved there from there to Howard Cancer Center, did triple negative cancer. Breast cancer research. Then from there, I went to Philadelphia, and Philadelphia has been my home ground for many years, and I have been working at majority of the Ivy League institutions and the top-notch hospitals, whether they were affiliated with public health or clinical research. That is Children's Hospital of Philadelphia, Hospital of University of Pennsylvania, Permanent School of Medicine. I was the head of research and director of the investigator research unit at Fox Chase Cancer Center. That was the first NCI designated comprehensive cancer center and the first cancer center actually in United States. From there, I was the senior vice president, head of R&D at FSD Pharma. And from there, I got to, in 2021, to Ocugen as the head of vaccines, and then I became the head of clinical development. What led me to do that was persistence, perseverance, and thinking outside the box. In fact, I do believe there is no box to start with. And when you are a physician, you're only thinking in your early years of your career that you just have to sit in the OPD rooms or in the clinical rooms or the ORs to kind of like look at the patients and kind of like work there and from the clinical capacity. I think I always had a passion to not look at the tip of the iceberg, like
Right.
that's the common phrase when we take into reference in public health, as well as the incidents of Titanic is all in front of us, that we fail to look at what is we look at the tip of the iceberg, but not the underlying factors. So I was more committed to public health. I was committed to community medicine as well. And when I came to US, my passion after working at Yale and one of the top Ivy League institutions in US became that, oh, you know what, we have to create a difference and physicians have to be there, whether it's health policy, whether it's clinical research. And that's where I will tell you that I came and I created opportunities for other people as well, led the departments from scratch. And one of the fortes that I always talk about myself is that I build programs from scratch. You give me a broken thing, I would make it work with minimal
Great.
resources. And I think for foreign medical graduates, whether they are from India, whether they're from Pakistan, whether they're from any part of the world, it's very difficult to navigate when you come to US. And I think I have developed that path. I have gone through that path and have mentored a lot of people. And I think that's why I think I was nominated and I was able to win this award, which I really feel obliged and I'm very grateful to the team at Health 2.0.
I see. Well, that is really good to know about you. Like, obviously, you shared a lot of things, like how did you started and where did you started initially, and now where are you? That is really good to know about you. Other than that, like if we talk about this whole healthcare industry, like how do you think like this industry is, transforming lives at a global scale?
Yes, I think the word healthcare has taken a different meaning in the past few years. And I'll tell you, from public health to clinical research to pharma, biotech, to academia to artificial intelligence. I mean, there has been a lot of, I would say, terminologies that we have seen, and it has been a roller coaster ride, but for the
Right.
best. Um, I would like to talk about the new normal, and that has happened, I would say, in the past 3 to 4 years when the pandemic COVID
Right.
19 did hit the world. The things that were not normal are the new normal, and change has been the only constant thing in the pharma biotech industry. And
Right.
I think innovation. I always believe in the theory of diffusion of innovation, and I also believe that we have seen a lot of advancements, whether it has been on the patient's front, whether it has been on the clinical research side, and particularly in the pharma and biotech.
Right.
Um, we have taken the things to the next set of level where we are addressing rare diseases. We are addressing HIV, new
That's
therapies.
right.
We are, whether you look at in the field of oncology, I think there are so many options right now. And I think the pharma biotech industry has gone bold. They
Right.
are now more patient centric. And I think that's where, the shift has been. One of the key things that I would like to talk about is artificial intelligence. And I think I keep on reading about it, keep on hearing about it. And I think that has been the newest cool thing. And
Right.
I think what has led now, taken bigger platforms. I mean, it's a platform, healthcare and biotech, that, now IT has been equally involved. There are different pieces of the puzzle. You are
Right.
not only involving physicians, there are PharmDs, there are PhDs, so all of that. And I think every one of us are coming together and, having those pieces together.
Right. I see. Well, obviously, if we talk about the changes, yes, there are lots and lots of changes that are, occurring on daily basis. You said it correctly. Like, let's say if we talk about the IT industry, yes, there are lots of new things which is also coming. Let's say the pacemaker, there are lots of new technologies even related to that. So that is really good to know. Even I completely agree by the changes as you mentioned in this healthcare industry. That is really great. Apart from that, if we talk about the Health 2.0 conference, so even I would like to know it from your side. How has the conference been treating you so far?
I think it was one of the best experiences that I had. I think, first of all, I wasn't expecting. They're very thorough in their knowledge and research about the industry. And the best thing that I liked about the conference is that it's not only pharma biotech. You're
Right.
actually meeting a lot of people from other industries as well. So in case, you want to collaborate on certain other aspects, and you have your other networks or group that you want to collaborate with, that's
Right.
also creating difference. And I think that was one of the best things that I really liked about this industry. And that you want to connect and share the common goal.
Right.
With Health 2.0, one of the other remarkable, I would say, their achievements is that they are very, I would say, not only technical, but also they have a critical eye to what
Right.
is going to happen in the next few years. So they do identify young leaders. They also give chance to the young leaders, as well as the ones that have created a difference. So whether
Right.
it's from Middle East, whether it's from North America, I think all the continents are somehow put together, and one platform. And I feel the team has provided some exceptional support. They have been there. They have, I think, I should say kudos to you and to rest of the team members that I've interacted with. But also the diversity that I see in these awards and this conference was outstanding. And I think the cultural competence is one of the key aspects of effective communication as
Right.
well. And I think you guys have achieved it. So,
All right.
congrats.
Thank you so much for that as well. Please tell us where we can find more information about you, or where we can reach out to you, like about your website or your LinkedIn profile. Please do tell us.
Yes, so I'm currently head of clinical development at Ocugen, and Ocugen is a patient-centric biotech company where we are committed, where our mission and vision is to cure blindness. We are also committed to the public health initiatives, such as we are bringing mucosal vaccine. We are also
Okay.
looking at cell therapies, innovative cell therapies as well, and we believe in courageous and innovation. So you can definitely find information on ocugen.com. Also, I prefer, LinkedIn as well. If somebody wants to get some information, wants to connect with me, wants to have a meeting about the potential opportunities, or even for like collaborations, that would be LinkedIn.
Right.
So I am under the name of Huma Qamar, MD, MPH, CMI, and also Twitter. Twitter, I'm very active. I really like to, be active there. So Twitter under the same name, Huma Qamar, Dr. Huma Qamar. You can find me there as well. And I believe so Health 2.0 follows me there too. So if anybody wants to see that, they can definitely know about my recent achievements and any initiatives that I am working on, even on the personal level as well as on the professional level too.
All right, Uma. That was really good to know about you and your, thinking related to this whole industry. That is really adds value to us. And here, other than that, thank you so much for being here with me. It was lovely speaking with you. Even I'll be more than happy to see you in our upcoming conferences as well.
Yes, absolutely. And if I think I would love to do that, and it has been my absolute pleasure. On the note that we want to kind of like we are going today. I would like to tell rest of the people that never give up, believe in yourself, and hard work is a check that can be cashed anywhere.
Agreed, agreed, 100% agreed there. Anyways, thank you so much. It was a lovely speaking with you. Have a lovely
Perfect.
day.
Thank
Bye
you.
bye.
Thanks.